There is a rule that has been in federal law since 1997 and that the government's own auditors have enforced with settlements, sanctions, and published compliance guidance. And yet violations of it are still happening in nursing facilities across this country right now. The rule is called consolidated billing, and if you or a family member has ever been in a skilled nursing facility under Medicare Part A and received a separate bill from a third-party provider for services delivered during that stay, there is a meaningful chance that bill was illegal. I want to explain what this rule actually says, because it is one of the clearest and most misunderstood billing protections in all of Medicare. And then I want to walk you through the second illegal billing practice that layers on top of it, one that the Consumer Financial Protection Bureau and CMS jointly called out in a formal enforcement statement, which specifically targets the lowest income Medicare beneficiaries, and which results in tens of thousands of illegal bills every single year. Both of these are documented. Both have OIG enforcement actions attached to them, with dollar amounts, company names, and settlement agreements that are publicly available. And both continue to generate charges that patients and families pay without knowing they did not have to. Before we get into it, I want to hear from you. While a family member was in a skilled nursing facility, did you ever receive a bill from a physical therapist, an ambulance company, a lab, or any other provider that seemed to be billing separately for something that happened during the nursing facility stay? Drop it in the comments. After this video, you will know exactly what to do with that bill. And before anything else, everything I share here is educational, not personalized legal advice. For help with a specific situation, contact your SHIP office, which is free in every state. With that said, let us get into it. My name is Walter Barron. I am a state bar licensed estate attorney, and for more than 15 years, I have worked with families on nursing facility billing disputes, Medicare appeals, and the paperwork that nobody explains until the money is already gone. Let us get into it. When Medicare covers your stay in a skilled nursing facility under Part A, meaning you had a qualifying 3-day inpatient hospital stay and were transferred to a nursing facility for skilled care, Medicare pays the facility a single bundled daily rate. That rate is called the Prospective Payment System rate, and it is designed to cover essentially everything the facility provides during your stay: room, board, nursing care, physical, occupational, and speech therapy, medical supplies, most medications, lab tests, x-rays taken on site, routine services of nearly every kind. This bundled payment arrangement exists because before 1997, the system was different and worse. Nursing facilities could allow outside suppliers to bill Medicare Part B separately for services they delivered to residents. Ambulance companies billed separately. Physical therapy practices billed separately. Lab companies billed separately. And each of those separate Part B bills came with its own deductible and coinsurance charge to the patient, charges that piled on top of each other and created significant out-of-pocket liability for nursing home residents who had no idea they were being billed twice for care that was already supposed to be paid under their Part A coverage. The OIG and the Government Accountability Office both documented this problem in formal reports in the 1990s. Congress responded by passing the Balanced Budget Act of 1997, which created the consolidated billing requirement for skilled nursing facilities. From that point forward, the SNF became the single billing entity for virtually all services delivered to Medicare Part A residents. Outside suppliers could no longer send their own bills to Medicare Part B for services they delivered inside a nursing facility during a covered stay. They had to be paid by the facility itself, out of the bundled rate the facility received from Medicare. The rule is clear. The OIG's own Nursing Facility Compliance Program guidance, updated and published in 2025, lists non-compliance with consolidated billing as one of the specific risk areas that nursing facilities must address in their internal compliance programs. The guidance names it explicitly. That means the OIG has made its enforcement priority public, and any facility that is not following the consolidated billing rules has no reasonable claim that it did not know better. And the OIG has backed that guidance with real enforcement actions. In August 2023, a personal care company in South Carolina paid $255,041 to resolve allegations that it had billed Medicare Part B separately for ambulance transportation to and from a skilled nursing facility, when that transportation was already covered by the consolidated Part A payment. The company had been billing for a service the facility was already being paid to provide. That is the core of the violation. Charging twice for the same service, once through the facility's bundled Medicare payment and once through a separate Part B claim. In December 2022, an ambulance service in Massachusetts paid $272,300 for the same pattern. These are not edge cases. The OIG has documented them, pursued them, and published the settlement agreements for public review at oig.hhs.gov. What this means for you directly. If any outside provider, a physical therapist private practice, a lab company, a transportation service, a medical equipment supplier, a visiting physician group, sent you or a family member a separate bill for services delivered while your family member was in a skilled nursing facility under Part A, and those services are within the consolidated billing package, that bill was almost certainly improper. The provider should have been paid by the facility as part of the bundled rate it received from Medicare. If your family paid that bill directly, you may be entitled to a refund. If you never paid it but received a collection notice, the collection itself may violate additional federal consumer protection law. There is one thing to know about the boundaries of this rule. Consolidated billing covers the vast majority of services delivered inside a nursing facility during a Part A stay. But CMS does maintain a specific list of excluded services, high-cost, specialized categories that outside providers can still bill separately. Chemotherapy is the primary exclusion. Some physician professional services are excluded, and CMS publishes an annual updated list of excluded procedure codes, which was most recently updated in December 2025 for 2026. If you are trying to determine whether a specific charge falls inside or outside the consolidated billing package, your SHIP office can help you look it up. Or you can search the CMS SNF Consolidated Billing Guidance directly at cms.gov. For routine therapy, lab work, transportation, and supply services, which are where most of these improper bills originate, the rule almost always applies. Now let me describe the second illegal billing practice, because it operates in the same space and affects a very large number of nursing home residents, specifically the ones who are least able to absorb an unexpected bill. It involves a group of Medicare beneficiaries called Qualified Medicare Beneficiaries, or QMBS. If you are enrolled in the Medicare Savings Program at the QMB level, which is the most comprehensive level, covering premiums, deductibles, copays, and coinsurance, federal law prohibits any Medicare provider or supplier from billing you for Medicare cost sharing. Not some of the cost sharing, all of it. Deductibles, copayments, and coinsurance are legally off the table for QMB enrollees. The provider must accept Medicare's payment plus whatever Medicaid pays as payment in full. Full stop. This protection does not depend on whether the state fully reimburses the provider for the cost-sharing amount. The CMS has said this explicitly in its published guidance. Even if Medicaid pays nothing, the provider cannot bill the QMB enrollee. The billing prohibition is absolute. Violating it means violating the provider's Medicare participation agreement, and providers who do it are subject to sanctions, including exclusion from Medicare. In 2021, approximately 8.7 million people, about 1 in 8 Medicare beneficiaries, were enrolled in the QMB group. The Consumer Financial Protection Bureau, and CMS, issued a joint enforcement statement in October 2024 specifically because they were still receiving widespread reports of providers, including nursing homes, improperly billing QMB enrollees for cost sharing. The statement was direct. These bills are illegal. Providers must refund any improper charges. And debt collectors who pursue QMB enrollees for these bills may be violating the Fair Debt Collection Practices Act. Here is the part that matters most, and the part that generates the most harm in practice. Many QMB enrollees do not know they are protected. They receive a bill from a nursing facility or a hospital that looks completely official. It is printed on the provider's letterhead. It references their dates of service. It has a balance due at the bottom, and it arrives by mail or appears in an online portal alongside all their other medical bills. They pay it because paying bills is what responsible people do. And no one at the facility calls to say, "You are a QMB enrollee. This charge is illegal. You do not owe this." The CFPB has received reports of these bills cascading into debt collection actions and negative credit reports. A person who cannot legally be charged for Medicare cost sharing ends up with the charge in collections, which creates lasting financial harm and a credit report problem built entirely on a bill that should never have existed. The CFPB has stated directly that debt collectors who pursue QMB enrollees for these improper charges may be violating the Fair Debt Collection Practices Act, which prohibits collecting on invalid debts. That means the billing violation does not just stop at the provider. It can extend to every collection agency that handles that bill downstream. If you or a family member is enrolled in QMB, which you can verify by calling 1-800-MEDICARE or logging into mymedicare.gov, and you have paid any deductible, copayment, or coinsurance to a skilled nursing facility or any other Medicare provider in the last several years, those payments were illegal charges under federal law. You have the right to contact the provider directly and request a refund. If the provider refuses or does not respond, you have the right to file a complaint with CMS through medicare.gov and a separate complaint with the CFPB through consumerfinance.gov. CMS has confirmed that providers must issue refunds for improper QMB charges, regardless of whether they received incorrect information about your QMB status from a Medicare Advantage plan. Let me leave you with the 3 steps that matter here, because knowing the law is only useful if it leads to action. Each of these steps is free. Each can be completed with a phone call, and any one of them has the potential to recover money that was taken from you or a family member illegally. The first step is to check whether you or a family member is enrolled in the QMB Medicare Savings Program. Call 1-800-MEDICARE and ask them to check the coverage information on your account for the QMB designation. You can also log into mymedicare.gov and look at the Medicare Savings Program information in the coverage section. If QMB is listed, that protection is active, and every Medicare cost-sharing charge you have paid since that enrollment date may have been improper. If you are not sure whether you qualify and have never applied, call your local SHIP office and ask to be screened. The call takes about 15 minutes. The screening is free, and the income limit for a single person is roughly $1,350 per month in most states. If your income falls within that range, which includes many people living primarily on Social Security, the screening is worth your time. Enrollment eliminates all Medicare cost sharing going forward and may give you grounds to recover improperly collected payments from the past. The second step is to pull out any bills you received from outside providers during a nursing facility stay covered under Medicare Part A. Outside means any bill that did not come from the nursing facility itself. A separate bill from a physical therapist's private practice, a lab company, an ambulance service, a medical supply company, a visiting physician group, any provider other than the facility. Write down the dates of service and compare them to the dates of the Part A stay. If the service was delivered inside the facility during the Part A coverage period, the first question to ask is whether it is on CMS's excluded services list. The most current version of that list was published by CMS in December 2025 for the 2026 benefit year. If the service is not on the exclusions list, and for ambulance transportation, routine lab work, most therapy services, and standard medical supplies, it is almost certainly not. That bill was a consolidated billing violation. Call the provider's billing department, reference the dates of the Part A SNF stay, and ask directly whether the service falls within the consolidated billing package. If it does, ask for a refund in writing. Reference the OIG's Nursing Facility Compliance Program Guidance, published in 2025 by name. That reference signals that you understand the legal framework and that the issue has federal enforcement behind it. The third step is to escalate what you cannot resolve directly. If a provider refuses to correct an improper charge or does not respond to your written refund request within 30 days, you have two formal complaint paths. For consolidated billing violations, file a complaint with your Medicare administrative contractor. The contact information for your region is available at medicare.gov. For QMB billing violations, file a complaint both with CMS through medicare.gov and separately with the Consumer Financial Protection Bureau through consumerfinance.gov. The CFPB and CMS joint statement from October 2024 confirmed that these complaints are being actively tracked and that providers face sanction exposure, including exclusion from Medicare participation. A documented complaint from you adds to the record and triggers a review that the provider cannot simply ignore. The OIG has published the settlements. CMS has published the guidance. The CFPB has issued the joint enforcement statement. Every piece of legal authority you need to make these requests is publicly available and has been there for years. The only thing that remains is whether you know to make the request. Now you do. If you know someone who has had a family member in a nursing facility under Medicare Part A, or who is currently a QMB enrollee and does not realize the billing protection that carries, please share this with them. The law is on their side. The only thing they needed was to know it existed. Thank you for watching.